You're listening to the Clinical Matters podcast with Lucas Furhauser and me, Nicole Vinitsky. Welcome to our latest episode.
Yes, welcome to Clinical Matters. It's a show brought to you by the European Association for Osseointegration, the EAO, a community of the leading scientific minds in implant dentistry.
Clinical Matters is all about celebrating and highlighting the exciting developments in implant dentistry. In each episode, we bring you an amazing guest to discuss their research and latest thinking in their fields. And most importantly, to support us all in our daily practice. In this episode, we will be talking to a great role model of mine that I've been following for a lot of years. We have with us oral surgeon Dr. Franck Renouard, working on the topic human errors since 25 years back. He's been publishing numerous scientific articles and also a book within this subject. He is also the past president of the EAO. But today, Franck, you're here to talk to us about how to avoid human errors when we're treating our patients with dental implants. Very welcome.
Thank you very much, Nico. Thank you, Lucas, for invitation. I'm very pleased to be with you.
Thank you for coming. It's really great. So let's get into it. So, Franck, you have experience in this field for, I think, 25 years. How do you decided to make research about this topic or to dig into this topic? What was the point, the moment? Could you tell us a little bit about that?
I was helicopter pilot. I did my training on American helicopter, and for any reasons, I bought with a friend of mine a Russian helicopter. And one day we were in the airport, and so I was very stressed and a lot of fatigue for personal reasons. And someone said, why you don't take off the helicopter? And I was designed as a guy to take the command and didn't dare to say no. And I was really under stress. I did the procedure properly, used a checklist. But the problem is the Russian helicopter has their rotor would turn in other way compared with American helicopter. And because of stress, when I took off a little bit too strongly, and the helicopter was unstable, and I pushed on the wrong pedal because of stress. And the stress doesn't allow you to reach your prefrontal brain. You are not smart. You are totally stupid. And you apply what you have in your library. Yes. Yeah. And the library was left pedal. No, that was the right one. And I crashed the helicopter. And
so it really you were up in the air when it happened and it crashed?
Yes, I was at 5 meters. Okay. And nobody died. Nobody was injured. I just destroyed 2 small airplanes. And then I tried to understand why I did these stupid mistakes. Why? Because I was a good pilot. I'm a serious guy, but I did really stupid mistakes. But I wanted to understand. And but in 1995, 1997, nobody in dentistry even thought about human factors. And even in medicine, that does not exist. But for me, that was so important to understand why I did these stupid mistakes. And I put my finger now in a good machine, and the finger and the arm and all the body went there. And I'm at least national and also international specialist in human factors for dentistry, for medicine, but also in different industries and nuclear plants or the trains or other, because this problem concerns everyone.
Amazing. So if we start from the beginning on this topic, why is a good level of clinical knowledge not enough for us to treat our patients in a good way?
Why? Because the clinical knowledge is what we call the technical skills. And to explain very easily, for instance, you want to make a vertical ridge augmentation. You go on a plastic model in a nice hotel, and you look at a lot of videos, and you do the surgery on the plastic model. That is a technical skills. And you are able, obviously, you know how to suture, how to fix the membrane, how to perform the membrane, you know. Now, the problem is to transfer this in a real life on difficult patient with not so large opening jaw, with a big tongue, with a lot of saliva. And that is a patient, the first time you saw the patient say, you know, doctor, I don't like dentist. You know this one?
Yes.
Yes.
We've met them so many times.
So, and now you have to reproduce your technical skill in real life. And that is what we call non-technical skill. Non-technical skill express the context. And the context, most of the time, are very nice. You reproduce more or less plastic model in the mouth. Sometimes no. And we must be able to be good all the time. Monday to Friday, nice patient, difficult patient. If your kids are sick at home and your spirit is encumbered with this problem, you must be able to concentrate yourself on the technique. But you are you can be, you as practitioner, you can be in bad mood, but your assistant also. We consider in our education that the assistant is always at 100%. Please, come on, that is not true. My assistant can be tired. My assistant can have a personal problem, and I have also to deal with this reality. And that is where the human factors can play a huge role.
Which tools you can recommend us to overcome this human factors or to avoid these human factors?
First of all, you have to accept that you are the weakest link. Yeah. You have to accept. You have to accept that you are going to make a lot of errors during your day. And all the studies, scientific studies and observation in a cockpit shows that the brain makes an average of 4 to 6 errors per hour. Most of them are insignificant. If you use a wrong number of your cellular phone, okay, we don't care. But if you do the wrong number in case of emergency, because one of your patient has collapsed, and instead pressing 112, you press 118. And that does not work. But because of stress, you cannot understand you did a mistake. And you continue 118, 118, and does not. So, first of all, accept this evidence. And now we have a lot of tools, very easy to understand. In theory, very easy to use in practice. The reality is more difficult because we are reluctant to change, to modify our practice. And for example, the briefing in the morning. In the morning, the team, 5 minutes, 10 minutes. Okay, what are we doing today? What are the threats? The threats, patient number 3, we have a surgery. He should have stopped anticoagulant treatment. Do we have checked? Okay. Patient number 4, it's a very difficult, aggressive, difficult patient. Are we sure that we have received the prosthesis? Yes or not? Your assistant can say, doctor, we have a problem because we have 2 surgeries, but I have only 1 set because you remember the end piece is broken and we have only 1 set. How we deal? We have to postpone 1. How do we deal? It's better to know at the morning that when your patient is on dental chair, you make the anesthesia and your assistant, doctor, sorry, but the end piece is broken. Oh, and you change your life. And the human factors allows you to apply your knowledge in a better condition.
I think it's really important also when we talk about this that we bring the patient into this equation, because what you said before, if we have a patient that's not in a good mood or it really changes how we treat the patient and what we can do. And I've thought about this a lot. And we all have these patients. We see them in our book in the morning, and all morning, like the first few hours, we have a little bit of pain in our stomach because we know this patient is going to come later on. The patient comes in And all we can focus on is that this patient should be content. She should be happy in the chair. We are not allowed to fold the chair as long as we want to, as far down as we want to. And if we make the patient understand that their mood and their actions are affecting the results of what we're doing, if we can talk to our patients about that, I think we could get to another level.
Yes, but the first point is to understand that this bad mood patient will influence you.
Yes.
That is the first point. And to understand, for instance, the impact of the stress on your decision-making process or your ethics. Because you say, we don't put the chair flat because the patient, etc. That means, okay, you are not treated well the patient because the patient you accept?
I always try to do the way I want to, but I always consider that now this patient is not going to be pleased because I have to do this or I have to do that.
Yes.
And of course, the less experienced you are, the more you listen to these signals from the patient.
We are talking about the real life. And to be honest, sometimes I'm a little bit, I said this diplomatically, disappointing by some lectures during the international congresses or national congresses when I see the fantastic case before, after, and everything are fantastic. But what was the time? What was the price? Not the money. But the money also is an issue. But what was the price to pay to go from A to B to Z? And we never talk about. That's the life. Yeah. And you have especially younger generation, they saw on the podium fantastic result. It's nice. They go home and they try and they have a catastrophe because they have not understand that the guy has 2 assistants, the guy work under sedation, the guy has 3 years for surgery, and also he has 20 years of experience behind to support. We have really to talk about real life.
Maybe let's go a little bit back to ourselves. So what is influencing us? I have, for example, 2 small kids at home. How about fatigue?
First of all, we know that the fatigue, tiredness influence the outcome and the quality of the surgeries or quality of the treatment. We do know, we have a scientific study comparing a surgery done 5 hours after the rest or 17 hours after the rest on the mannequin, and the people have found significant differences. The first point is, during the briefing, to make what we call the forecast, in French, a météo, means how are you? And you must be there to say, today I'm not in good shape because my kids, and they have the kids' disease, and I sleep only 2 hours. And you must say to your assistant, please be careful. You have to control me and be sure that. And maybe you have to say, okay, for this patient, vertical ridge augmentation, I'm not in good mood. We don't take off. You know what is a good pilot? The best pilot of the world?
The one who says no when it doesn't have the strength.
The pilot who have as many landings and takeoff.
Yes.
That is a good pilot.
That's true.
The problem of looping is another story. And for you, a good surgeon is a surgeon who treats the good patient in a good condition. And also that is another story, who is able to treat his own complications, but that will be another podcast.
But that is really interesting, to listen to yourself, to see that this is actually something that I can do now. Because we were also talking about that in another episode, talking about immediate implant placement, that once you start and maybe you see that this is not the case, you have to allow yourself to back and to say, no, this is not the case to do this. I'm going to redo the plan and do according to another plan that is working.
Yes. And we have to accept our weakness. A friend of mine is pilot, and is the commander, the boss in the airplane, and he was in Hong Kong, and he had a problem with a jet lag. He was really tired. And in a cockpit, he told to us to co-pilot, okay, I didn't sleep well, please be careful. And during the preparation, he did 2 mistakes. But the guy were not only were aware about his state, but also they were able to say, because the gradient of authority was decreased. And in cockpit, the co-pilot can say no, and he has not to justify. That means that your assistant, your team, your collaborator must be able to say, doctor, stop. And in my practice, my assistant, Emmanuel, fantastic assistant, and she called me doctor. But when she said, Franck, immediately that was a red alarm. And I didn't discuss with her if that was good or not. I trust her. And she said, Franck, and for example, I remember I was removing a big cyst, and I didn't have a good view of the cavity because of parallax and so on. And I was ready to close. And Emmanuel said, Franck, and she gave me the curette. And that means, okay, I have forgotten some granulation tissue. She saved the treatment. And I don't say, you have not to talk to me, I'm a doctor, you are the assistant. Say, thank you very much, Emmanuel. Because we're a team.
I think this is very, very important. And when you think about the environment in your private practice, how should it be? Should it be open doors, music? What do you recommend?
I was very strict. The operating room must be sacralized. Sacralized means it's not a common room. And when you go in, you close the door, and and first of all, I had a ritual, always the same ritual. I have not to describe, but everybody can have his own ritual. The ritual is to warm up my system 2, my rational mode of the brain, not to use, but is ready to be used. And then we apply what we call cockpit sterile. Cockpit sterile is a rule from aviation. It was decided in 2001 after some crashes because the people were not concentrated during landing. So they have decided below 10,000 feet, it is forbidden to talk anything else than the procedure, forbidden to eat, forbidden to read a paper or to drink a coffee, forbidden. Because the brain is not multitasking. You cannot do 2 things, rational or rational things in the same time. It is physiologically impossible. So when I worked, that was forbidden to interrupt me during surgery. It's not because I'm arrogant and I'm a boss. It's just because I know how the brain functions. I spent hours to understand, and now I have good knowledge on that topic. And I know that if you interrupt me, I need minimum 3 minutes to come back to my initial thoughts. And imagine, you are doing a difficult surgery. Your assistant comes and says, next patient will be late. What do? You have to disconnect the neuronal network suture to go to neuronal network next patient, and the next patient, you know who is? Your patient you don't like. Mm-hmm. You know? You
yes.
say this one. and you start to put the hamster in the machine, and that turn, you turn. Do you think you will be able to make your suture properly or no? And even more, when you go back from your next patient to my suture, you can create forced memory.
What do you mean? Say again, forced memory.
Forced memory means you are sure that you have cleaned.
Okay.
And if I say, Nico, have you cleaned the root? Yeah, yes. No, I can show you the video.
I got interrupted and I thought that I did something that I didn't.
Exactly.
So like double check.
A double check is your assistant because your brain will always confirm what you think. That is what we call confirmation bias. You confirm.
Very good recommendation.
If you read 23 on the paper, why it's 25, you can read 10 times. You will read always 23.
Mm-hmm. But I think this is really interesting with interruption because it is getting more and more into our daily life. We all the time have our phones, we have our computers, emails are popping up, there are things happening on social media, and we always need to be present at all these places at the same time, even though I think and I hope that most people don't do it during surgery. But doesn't it affect also what we're doing in our practices when this is happening all the time? Something must happen to our brains when we get that much input all the time.
The interruption create problems. You increase the number of errors, procedural errors, medication errors, and so on. So obviously it is impossible not to be interrupted for the 8 hours. It's impossible. What you have to do is to define, you and your team, what are the time, sacralized time. Mm-hmm. This time, I don't want to be interrupted. For example, for me, that was the surgery, but for your assistant, that could be when I control the stock, I don't want to be interrupted. For a guy who work on a computer to prepare simulation, he must not be interrupted because you can make errors, stupid errors, and you send not the good files to the lab and you receive a bad surgical guide and so on. Yeah, okay, stupid common story. So you have to define in a group that when you must not be interrupted.
I think we need to talk so much more about this because I think it's getting less and less accepted that you're not allowed to be interrupted. Because in everyone's world,
yes,
so many things are happening, and you're expected to be able to take the phone call or answer the question or do this at the same time as you're doing something else.
I talk about science. I don't talk about emotion. And in a cockpit, for instance, you go in a cockpit and the pilot is calculating something important. He has just to raise in hand, means don't interrupt me. Nothing impolite. Mm-hmm. Mm-hmm. I'm not impolite. We have a patient. We have to do the best for a patient. And also I have to do the best for me because when you have complications, you have always a second victim. We never talk in dentistry, but you have plenty of articles in medicine on second victim. You will pay the price also. So it's not just because I'm the boss and I don't want to be interrupted. I have a brain. My assistant has a brain. And the brain has a limitation. And I cannot be interrupted if I want to perform my surgery properly. No discussion, no issue. And for the phone are forbidden in operating room, just forbidden.
And Franck, we talked before about fatigue. What else can we do to our bodies to perform in our best way?
So you must consider yourself as an athlete. It's not a joke. Yeah. Because dentist is not a normal job.
Really? Explain what you mean by that.
Explain. What does it mean? You are working 8 hours a day or 10 hours for some people on 2 to 1 square centimeters on difficult patient under local anesthesia with the time pressure, with the problem of money. Because in hospitals, the people are very relaxed and never talk about money. If they want surgery, I want surgery. If I want to, I have no problem with that. And you have to deal with your team. You have to deal with your assistant. And your assistant, this one is difficult for you. It's a very difficult job. Very difficult. Technically and non-technically. It's really, you have few jobs in the same the vet. The vets are also very difficult. Mm-hmm. And in France, 30% of the dentists are in around the burnout. 30%. But I'm sure it's the same in Sweden and other countries, because you have a lot of pressure all the day. You have to think about your mission. What is your mission?
And what have you changed in your life?
The last 10 years in my practice were very soft. Very soft. Never, ever I have started a surgery without the good instruments of my table. It's not a detail. Eh? Never, ever I had a problem with a stock of implants. It's not because we have no problem with order, but the day before or 2 days before, my assistant was able to come in my desk, said, "Doctor, I did a mistake. I forgotten to buy the 8.5 millimeter implant, and you have on the patient files you need 3. I'm sorry, but I don't have." Okay, I can readapt the schedule. I'm not happy. She is not happy. The patient won't be happy. Mm-hmm. But what is the best is to say 2 days before and to postpone, or to open the flap and to place 10 millimeters implant very, very close to the nerve, or very, 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 very close into the nerve. So just think about mission. What is your mission? I give you an example. You schedule 1 hour for surgery. You do need 1 hour. And if it's just 1 hour, you are not in a good way, because most of the time you need extra time in case of. So I need 1 hour. And your secretary receive a call, patient he has painful, it's very uncomfortable, and she okay, and okay, you come and she reduce 10 minutes of your surgery. What do? You shorten the surgery?
I try to adjust.
Yeah.
You try to adjust. But your mission is, I need 1 hour. So reduce, and you run faster your surgery. Maybe you will make errors and the cleaning won't be so good. Or you are late, and you are late, and you are late, and your assistant
for the rest of the day, you're late.
Leave your office at 6 because she has personal issues, and you stay alone for last patient. Yeah. Someone will pay the price. So now, what do? In the morning, during the briefing, we identify the space for emergency. No discussion. If I need 1 hour, I have 1 hour. Exception 2 times per year. If something really, really, really wrong appears, the patient has a big bleeding, and obviously you have to adapt. But in dentistry, fortunately, we are very rarely in those situations.
We talked about interruption, fatigue, sound, environment, technical and non-technical skills. I know you're a really good cook. So what you were eating during your time in your practice? What were you eating for breakfast? Maybe it sounds strange, but I think it's affecting our life.
I'm laughing because during 30 years at the lunchtime, I have always eaten the same things. Carrots and lentilles, I don't know in English, lentilles, you will discover it's and always the same. Because I didn't want to uncumber my brain by choosing the food. If the food is not available, what I have to choose, I don't know, I don't like so much. No, always carrot and lentilles.
You keep the focus for decisions on the important things.
Exactly, because your brain cannot manage so many informations. We have too many informations for the capacity of the brain to decide. That is, we receive an average of 10 million of information per second, and the smart brain can deal only with 50. So, and for the food, carrot and lentilles, and that was very good because, first of all, I didn't have to decide. 2, that was just perfect not to be hungry anymore. And I didn't have to sleep after dinner because that was in perfect shape. And the morning, that was the same. I had always the same.
So if we should give some advice to our colleagues out there listening, what are the important things to think about? What would you do to shape yourself up? Both, I'm thinking about how active you are, and also eating, sleeping. Are there other things that you think should be brought into this equation?
So I'm not the best advisor because I don't make a lot of sport. I don't like sport. I have practiced a lot and very difficult sport like kendo, and I raise my ichidan, but I don't like sport. I try to do the minimums I can do. But obviously, you need to have to control your daily life and try to sleep properly. Because our job is very difficult, and I know the new generations, they look at the series until 1 a.m. or 2 a.m. Sorry, guy, it's stupid. Sorry, it's just stupid. You have the chance to be dentist. You have a chance to have a good job, and you are earning good money. Please accept your mission, but you have also to pay the price for this quality of life. And quality of life, it's to be available for your patients, available for your assistant, available for your team, and at the end of your career, for yourself also, obviously.
So what we're saying is that we all have the responsibility to see that we are the best of ourselves that we can be when we go to work. And that's, of course, different for different people.
I started my career, and just after graduating, I had the big chance to meet Jean-François Tulane. He was a maxillofacial, cranio and maxillofacial, and he was in a team of Paul Tessier. Paul Tessier is the guy who invented the craniofacial surgery. An unbelievable person. And I stayed 3 years with this person. And I go through the student life to the professional life, because when you have to, even if you are only assistant, but you have 10 or 12 hours surgeries, and on the babies where you remove the cranium to dissect the internal face of the orbitis, you cannot have a party the day before. You cannot.
No.
And these people learn me some technical things, but they teach me so many nice attitude.
And Franck, what about our emotional factors? So a good marriage, divorce, personal stress, debts. What do you think about that?
You have a scale of impact of this different event on your quality of life and risk of death. And you have a score.
Yeah.
You know that. But some people say it's not really true. But obviously, you have an impact. Obviously. And when sometimes we invite the fighter pilot or the people and say the problem must stay outside of your office, outside of the cockpit. Oh, sorry, it's stupid. It's impossible. Those guys, the top of the top of the top, they are not human, and they are selected among 10,000 people. You have two at the end, and also their environment is not the dental environment. They have coach, they have kine, they have a lot of people who take care of them.
But maybe we should also think about having a coach.
You can need people to open your mind and maybe to see what you don't see, because the stress, impact of the stress is to focus you. Mm-hmm. You focus on the problem and you are not able to take some distance and to look around. It's not possible. Once again, it's a physiology. Because if you have a lion in front of you, you look at the lion and you don't want to look at what happened behind you. Okay, so it's a physiology. But in your practice, if you are under stress, you focus on the problem, and maybe the solution is 2 meters on the left, on the right, And the coach can help you to open your eyes and to turn your head and to look at what you can adapt, change, or improve in your practice. It's a good idea.
When we are in the situation with the patient, there are so many things that we should keep track of at the same time. We should see that they're comfortable, they should open their mouth enough, we should have to see what the assistant is doing, and we're supposed to do what we're supposed to do in the mouth. And I so often find when I take pictures and then I go and I look at the pictures, I so often see things that I didn't see when I was in the mouth of the patient.
Yes, it's normal.
Yes, because I'm so busy with all the other things around.
No, you have not to be so busy. I tell you a story. And that was not when I have started. That was when 3 years ago. I received a patient to remove the second molar maxilla left. And the specificity of this story is I received by email the letter, please, Frank, remove the teeth and place 2 implants, and the X-ray. So I had I saw the X-ray before opening the mouth of my patient. On the X-ray, I see the proximity of the root with the sinus. It's not a big deal, but 2 years before, I had a patient, I removed the teeth, I have an infraction in the sinus, we don't care, but he did a big infection. And that was not the patient to have an infection, okay? And I keep unconsciously in my mind. Second point, I saw a septa in the sinus. Immediately, I started to do, okay, I have 2 windows or only 1 window. Okay, I see the patient 2 weeks later. I removed the teeth. Everything went well, cool, relaxed. At that time, I saw big epulis on the canine. They, what's that? They, oh, yes, I have this problem since 2 months, but the dentist told me to see a specialist. I'm not the time. Blah, blah. I didn't see this tumefaction during the clinical examination and during the surgery because my brain focused on the threats. Mm-hmm. And for my brain, the threats was proximity and septa. And all the rest, you erase. It's not you, it's your brain. You understand?
Yes.
And when you examine a patient Monday morning or Monday evening, you won't see the same thing. It's why the protocol are crucial. Mm-hmm. And never, ever look at the X-ray before the mouth.
And we talked before about aviation and airplane industry. So what we could transfer of the safety of the airplane industry to the dentistry or implant dentistry?
We can transfer a lot of things, but I believe the most important is a team approach. Your assistant is not there to clean your instrument. She is there to help you, and she can say, Doctor, or Frank, or Lucas. And when she says Lucas, okay. But you have to develop this relationship. You have to allow your assistant to talk to you. You have, and sometimes not to be so kind. I believe that is probably the most important. And sometimes I make lectures with a friend of mine. She's a hostess, and she is also a teacher in CRM. And she is able to explain to the nurses or nurses or our dental assistant how important they are in the safety and the quality of life and quality of outcome for patients.
What about checklists?
The checklist is the good way not to learn how to do things, but to be sure that you have done the things properly and in a good order. That we have a lot of publications which demonstrate clearly that if you use a checklist, you save life. In operating room, you have a difference of 30% less mortality, 30% comparing people who use a checklist and who don't use a checklist. So the checklist is just to be cool. I'm sure that my patient has no allergy. I'm sure that the patient has fulfilled the paper. It's not a detail to have the consent. I'm sure that the patient has a good medication. I'm sure that we have not the time, but I can tell you so many stories of adverse events because bad use of checklist in dental practices.
We're coming closer to the end.
No.
But before we do, first I want you to tell us about your new upcoming book. Could you please tell us what that is about?
Yes, and I have written a new book. It's 2 tomes on crisis situation in dental offices. A crisis situation is when something happens you didn't expect. You have to do something immediately, but you don't understand the situation.
But like what kind of crisis? Like fire or like
could be fire,
like
could be heart attack, could be very difficult
really
patient. Suddenly the patient become crazy. And the first book is to explain why you are not acted as you are supposed to do because of the stress, the brain issues, etc. And we also develop the protection of the bad reaction against in case of crisis situation. And the second book is about cognitive aids. Cognitive aids is a sort of checklist because if you have a heart attack or your patient has an anaphylactic shock, your brain will be difficult to use. And so you take the paper and say 1, 2, 3. And someone reads the paper and you follow the procedure because you cannot trust yourself. And just a parenthesis, in case of heart attack, the first point is design the leader. Who is the leader? Because the leader maybe is not the dentist, could be the assistant because the dentist is freezed. Okay. And so it's that was a passionate journey. I've learned a lot of things, and it's once again it's never discussed in dental practices. That is a human factors aspect of the emergency procedures.
Could you give us 3 pieces of advice we should change Monday morning?
So the human factors is a science. So it's not a magic trick and you have to go to school. You have to read papers. You have to listen podcast. Thank you very much for the invitation. You have also to read books and to follow education, training education. So that is the first point. The second point is you have to bring your team in this issue. You cannot make the journey alone. If your assistant don't understand why you don't want to be interrupted, that won't work. And then you go slowly. If you want to change, let's say, okay, in 1 or 2 years, I will transform my practices. And you start by briefing, then you introduce some checklist, not for all the situations, because for assistants that will be very difficult, and checklist for some surgeries, for instance, checklist for opening the the surgery, or and then you can continue to make, and at the end you will do the debriefing. Debriefing is probably the most difficult in human factors tools.
But also a very good tool to use. I think I want to start with that.
Yeah.
Franck, thank you so much for being here. There are so many more questions and things that we would like to talk to you, but unfortunately we have to end at some point.
Yes.
But it was amazing.
I think sometimes we are forgetting about these things and see only the technical things. So thank you very much for reminding us.
That was a big pleasure.
And to all our listeners, thank you so much for joining this episode of Clinical Matters. It's been a pleasure having you with us.
Join us next time for more great insights and tips, all to help you deliver excellent care for your patients.
And Keep doing the work you do because it's really great. And in the meantime, please follow, rate, and review the podcast. It really helps others to find it. See you next time.
Bye for now.